There are types of cancer that require a very specialized therapy in order to be cured. In such cases, a so-called blood stem cell transplantation may be considered. Your child, or you as a teenager, will first receive a high-dose chemotherapy, followed by a transfusion of new blood stem cells. But what exactly is a stem cell transplantation, and when is it actually used? We want to answer these and other questions in the following videos. But first, it's important to understand what stem cells actually are. And that's what we're going to talk about now. Stem cells are the original cells from which all other cells in the body are derived. You can think of them a bit like cake batter. At first, it's just an unfinished, raw mass, but through various steps you can turn the batter into all sorts of delicious treats. For example, lemon cake, strawberry tarts, chocolate muffins, whatever you like. It's pretty much the same with stem cells. They're also still unfinished, but they can develop into all kinds of specialized cells. As you might guess from the name, blood stem cells are meant to turn into blood cells. In scientific terms, they're called hematopoietic stem cells, which basically means blood-forming stem cells. They are located in the bone marrow. The bone marrow is a soft, spongy tissue found inside many bones, for example in the skull, the breastbone, and the pelvic bone. So every time a blood stem cell divides, two new cells are created, another stem cell and a blood cell. The blood cell then develops further into a red blood cell, a white blood cell, or a platelet, depending on what is needed at the moment. Once the new blood cell is ready, it hops from the bone marrow into the bloodstream and carries out its function there. You can probably imagine what happens if this process is disrupted. If blood cells can no longer be produced properly, it can become life-threatening over time if no treatment is given. Which brings us back to the question, when exactly does someone need a stem cell transplant? In the case of cancer, there are essentially two main reasons for this. Either because the bone marrow itself is the origin of the cancer cells, or because the bone marrow has been so severely damaged by intensive cancer therapy that it can no longer be repaired. Okay, I think we need to take a closer look at this to really understand it. First, let's look at the situation when the bone marrow itself is diseased. So yes, here we have our bone marrow with the stem cells inside, and they're infiltrated by, here you can see it, by these black cancer cells. This means that the cancer cells originate in the bone marrow and gradually take over the space from the stem cells. As a result, normal blood formation is increasingly suppressed. This is typically the case with acute leukemia. In most cases, a standard chemotherapy is enough to get rid of the leukemia cells. At the same time, there are usually still enough stem cells left to get everything running again. But sometimes you have to go one step further to achieve a cure. For example, it can happen that after treatment, some cancer cells remain in the bone marrow, and those will cause the disease to relapse. And that's exactly what we don't want. Of course, you can't just fish out the remaining cancer cells from the bone marrow. Look, I can't get it. I can't get them. No, I can't. The only way to reach all of them is to destroy the entire bone marrow. Wipe everything out. Boom. There. To do this, you have to undergo high-dose chemotherapy, sometimes combined with total body irradiation. So now, this process, in which the bone marrow is essentially emptied out, this is called conditioning. And after the high-dose chemotherapy, new stem cells are given or transplanted to rebuild the bone marrow. Like this. There. For this to work, you need healthy stem cells, yes, that somehow get in there. If the stem cells don't come from the patient, meaning from yourself, but are donated by another person, this is called an allogeneic stem cell transplant. And we've made a separate video about how to find a suitable donor. But now let's get back to our original question. When do you need a stem cell transplant? We've clarified one reason: to replace diseased bone marrow with healthy bone marrow. The other reason also has to do with high-dose therapy. But in this case, it's not the bone marrow that's diseased, but the cancer is located somewhere else in the body. And the only way to cure this, you might need, for example, high-dose therapy. For certain tumors like neuroblastoma, it is simply necessary, or sometimes also in the case of a cancer relapse. In such cases, a particularly intensive chemotherapy with or without radiation can be a way to get rid of all the cancer cells. As a side effect of this intense treatment, unfortunately, it doesn't just destroy the cancer cells you want to target, but also some of the healthy cells, such as the stem cells in the bone marrow, right? So that means a part of it is simply gone, you know? So then the supply has to be replenished again. In most cases, you can use your own stem cells before starting high-dose therapy. Those are fine, right? If the stem cells come from the same patient, meaning from yourself, this is called an autologous stem cell transplant. And for this, a certain amount of stem cells is collected and stored before the high-dose therapy begins, right? So basically you say, okay, let's take a few out, store them, and then later put them back in. All back in. We'll also explain exactly how that works in another video, but now we are almost at the end of our little introductory course. So, I hope you've gotten a first overview of what stem cells actually are and why a blood stem cell transplant can sometimes be necessary. By the way, no surgery is required for this. The donor or your own stem cells are simply given back through the venous catheter, just like a blood transfusion. That's basically the easiest part of the whole process. In the following videos, you'll also learn more about the entire process and why it's not all that simple. Because this is, after all, a very intensive therapy that comes with many challenges. But that's exactly why we're making these videos, to offer some guidance and help you prepare as best as possible for this challenging journey.